it's digital therapeutics is a term that is new to the industry, and I think there's a lot of learning that's happening in terms of how can we leverage digital therapeutics to help improve quality of life for the people that we serve in healthcare. And I just wanted to kind of zoom out and talk about the category of digital therapeutics more broadly, and then look at how some organizations, including ours, Generation Connect, is using digital therapeutics specifically to help people with dementia. So the one thing I wanted to ask of the group as we go through this, if you do have questions, pop them in the chat. I've presented this information to a few different groups, and I find that when the presentation is more interactive and we can kind of cater it to your thoughts or your questions as we're going through the material, those tend to be the most productive. So feel free to jump in with thoughts or questions as we're going through the information. So with that, I'm going to share my screen. And hopefully you'll be able to see my slides.
Yes, we can see them.
Great. So we're going to talk through digital therapeutics on 3 levels. The history of digital therapeutics. So some of you may be thinking, well, I don't even know what that is. So we're going to define it, and then we're going to look at some of the research on how technology platforms involving music, computers, peripheral devices like virtual reality and wearables are being used in the treatment of dementia. The next thing we'll do is talk through some of the challenges. What are the barriers that are preventing the widespread adoption of digital therapeutics in healthcare settings? So things like the finances and the logistics of implementing these types of technologies, but also considering the culture of healthcare and the stigma around dementia. And then the last part is the part that I think is the most fun, kind of looking at the trends, what's happening in the space, and what types of factors are going to lead to accelerated adoption of technology to help prevent, manage, and treat dementia. So you all know Robin. She gave me a little bit of background, so we're just going to go ahead and jump right into it.
Yeah, they really just want to see how it works. They want to see those screens, so that's exciting.
Well, I'll just start by defining kind of more broadly the space. According to the Digital Therapeutic Alliance, digital therapeutics are evidence-based therapeutic interventions to patients that are driven by high-quality software to prevent, manage, or treat a medical disorder or disease. So we're going to look through this through the lens of dementia. So I want to break down that definition, and there are a few key components that I think are important to understand. The first is that there needs to be a hardware component, so some type of device that's being used to facilitate the treatment. So that could be a portable music player. That was one of the first devices that's widely used in dementia care. I think many of you are familiar with that through the work of Music and Memory and others. It could be a computer or a tablet. That platform is really accelerating with the development of new software. And now we're seeing kind of the emergence of peripheral devices for mobile computers, things like virtual reality headsets and wearable computers that are being used in therapeutic context. So the second component is high quality software. So this is really vital to the efficacy of digital therapeutics. And one of the things that we'll discuss is software is often a limiting factor in being able to efficiently deploy these in healthcare settings. And the quality of the software is key, because if it's too cumbersome, if it takes too much time, or it's too difficult for staff to use, it really is going to limit the therapeutic context. And then the last and one of the most important components is these solutions need to be vetted and supported through research. In the case of dementia care, this can be extremely challenging because Alzheimer's disease related dementias, they're progressive in nature. So measuring outcomes is challenging. And there's also an additional administrative burden when it comes to measuring outcomes. And healthcare staff, especially now more than ever, has really limited resources. So conducting research within the context of a healthcare setting can be difficult. So I just want to touch on the three platforms I mentioned previously and kind of where they're at in the landscape of digital therapeutics. I mentioned that digital music players, this is one of the most widely adopted technologies that's used in a therapeutic context for dementia. And there's a lot of good reasons for that. Personalized music, the evidence base to show some of the therapeutic benefits is really strong. It's been shown effective at mitigating anxiety, boredom, sadness. There's thousands of nursing homes, assisted living facilities, skilled nursing facilities that have deployed these devices. And there's also a pretty robust evidence base across certain care settings, specifically nursing homes. The challenge with music players is often on the software side. It can be really time intensive and cumbersome for healthcare teams, whether that's in a nursing home or assisted living facility, to load personalized music playlists and adjust them. They're often using consumer software like iTunes. It's a manual process of plugging the device into the computer and pulling songs on and off of a particular piece of hardware. So it doesn't scale very effectively in a healthcare setting. With tablets, the adoption is outpacing the research. And one of the greatest strengths of the tablet platform in a therapeutic context is it's really versatile. You can use a tablet for music. You can use a tablet for reminiscing. You can use a tablet for socialization, for cognitive stimulation. And because the platform is so versatile, it's hard to draw definitive conclusions from the research base because there's so many different variables to control for. So with the tablet platform, as the software evolves and improves, so is the quality of research and the outcomes. And I'm going to share some research that's being done, some that our group is involved in and some that our group is not involved in. But to me, this is like a very compelling platform because of the multimodal opportunities. You have the auditory stimulation, visual stimulation, the socialization aspects. There's a lot of potential to unlock in tablet-based and mobile-based therapeutic interventions. The last platform, we're not going to spend a whole lot of time on this, but it's definitely worth discussing. There's emerging evidence to support the use of virtual reality and wearables. And there's lots of potential on the virtual reality side. These can be really novel emotive experiences. On the wearable side, the ability to track physical biomarkers continuously. There's a lot of research potential there, but these devices are very much in the early phases. They're not at the given moment, they're not very cost effective because they're pretty expensive. The hardware platforms haven't fully matured. So there's really limited existing research on these devices, but it's definitely a trend that's accelerating. So before I kind of dive into some of the research, I just want to pause and ask if anybody has any questions or thoughts or comments specific to what we've discussed with digital therapeutics so far.
Michael, Linda Postek said that she knows a functional medical doctor that uses specific video games with dementia patients to improve memory and cognition.
Yeah, there is some research being done on that side. In my experience with those types of applications, the use case is really more in mild cognitive impairment in early stages as intervention to maintain functional abilities. Those become a little bit more challenging to implement for people that are in the moderate or late stages of dementia, but very promising on the MCI front, delaying the progression of symptoms. Dementia is very difficult to talk about because there's so much variability across somebody that has early onset Alzheimer's and 55 years old versus a 93-year-old with several complicating health conditions in the late stages. There's just such a wide range of needs and abilities that we have to make sure that we're specific in how these interventions can be used depending on where the person falls on that continuum. So I'm not going to spend a whole lot of time on music. I would assume that most people here are familiar with the connection between personally meaningful music and dementia. There's some very interesting research on the topic, and I'll link to some of the research in the slides. And I'll share those slides if anybody wants to pull up some of the most notable research study. If you haven't seen the documentary Alive Inside, it does a great job of explaining the therapeutic potential of music. And this has been validated both on the clinical side, looking at specific outcomes, whether that's the impact that it has on behavioral symptoms like agitation and aggression. But there's also been some pretty compelling evidence on the physiological side, showing that personally meaningful music activates brain areas that are connected to long-term memories and emotions. So music as a therapeutic intervention probably has the most robust evidence-based. And here are the studies, just a few studies that I mentioned, more recent studies that are showing some of those clinical and physiological benefits. With mobile computers, again, I mentioned this earlier, this is rapidly evolving. This is changing from month to month, and there's a variety of use cases, whether that's the socialization, which in the era of COVID has become critical in a variety of care settings. The reminiscence therapy tools, there's some pretty compelling data on that. There was even there was a device in 2019 that got breakthrough FDA clearance for the treatment of behavioral symptoms of dementia using reminiscence therapy. And an area that we're exploring is the use of tablet computers to enhance the caregiver and the care recipient relationship, whether that's a formal caregiver and the care recipient, or whether that's a family care partner and the care recipient. So we'll discuss some of that research as well. I discussed this earlier. The research, it's really hard to analyze because typically these studies have small sample sizes, tend to be not the most high quality studies published in peer reviewed journals. And there's really, up until recently, because this has changed, there's been a lack of collaboration among the technologists, the people that are making the software, the policymakers, the payers, the care insurance providers, and the healthcare providers themselves, the people that are on the front lines. So that lack of collaboration has also kind of limited the potential of digital therapeutics on mobile platforms. I'm there are a few different studies that I think are meaningful when it comes to mobile computers and digital therapeutics. This is just a real sample, or this is real small sample of the research that's out there, but I picked these specific studies because they kind of highlight some key use cases. The first study actually shows the impact of socialization through digital platforms. So this was a longitudinal study, 15-year episodic longitudinal study, and it actually showed that older adults that engaged in social activities both online and offline had a reduction in episodic memory loss compared to older adults that just socialized offline. So that's really interesting to show how combining online and offline socialization can have benefits on cognition. I also included a study about the device that used artificial intelligence for reminiscence therapy. That device got breakthrough FDA designation as a digital therapeutic tool. The company ended up not being able to commercialize the product due to some challenges taking it to market with reimbursements, which is a challenge across the entire digital therapeutic space. But really compelling that they were able to gather data to show that this tablet that played stories that were recorded by family based on the care recipient's mood was effective at mitigating symptoms. So that's really kind of compelling evidence. And there are some other companies that are kind of following a similar path to collect some clinical data to demonstrate that. And we're one of those companies. We've recently published some peer-reviewed research looking at tablets specifically as a digital therapeutic intervention through a caregiver. And I think that's a key distinction that differentiates our approach compared to some of the approaches that have come before us. A lot of the digital therapeutic solutions in the past have looked at the tablet as a direct intervention for the person living with dementia, whereas we are viewing the tablet as a caregiver-led intervention. And I think that's a real key distinction. And it was really our clinical team that helped guide us in our product team in the direction, because older adults lose the ability to self-initiate with dementia. Having the therapeutic intervention be led by the caregiver was really key to the efficacy of the solution in the mid and late stages of dementia.
That's wonderful.
Yeah,
Michael, Linda made a couple comments. She said that her mom had, a significant decline in Alzheimer's, and the music in her life really contributed to giving her joy and trigger the happy memories that activated her ability to engage in conversation. And then she said that, yeah, we can all relate to the combination of being in person and an online connection with our own mental and physical and spiritual health during the pandemic that we just had. So
yes, Linda and I are very much on the same wavelength on those comments. And just to kind of build off of the comment on music, what we are really finding success in doing is leveraging those experiences that trigger happy emotions. So music is one that I think we can all relate to. There are certain songs that when you hear a certain song, it takes you to a place, you feel the emotions of, that memory or that experience. And it's a physiological response, right? It's just something that happens. So what we're really looking at doing with the software is helping caregivers leverage that as part of a routine, and ultimately the ultimate goal is to develop rituals that then help to limit behavioral and psychological symptoms, anxiety, anger, boredom, confusion, and that's where the potential really is, whether it's music, whether it's conversations with our loved ones, whether it's a YouTube video. I mean, we've seen all of these different mediums of content be effective. It just, the key is it has to be personally meaningful to the care recipient. And I saw a question, or I saw a comment about a television channel radio station that can turn on for people that are living with dementia. And there are, specifically, we're working with a company called Zinnia-TV, ZINNIA.TV. Typical TV programming becomes very hard for people with dementia to consume, especially as they progress through the latter stages. And with Zinnia TV, they're providing content that is specifically designed for somebody that has memory loss. There's slower paced videos, there's no dialogue. They have very kind of immersive, immersive video content. It's really compelling stuff, and just another tool that you can leverage through a tablet platform to spark or help manage mood in this context.
Michael, where can you locate Zinnia?
Well,
ZinniaTV.com.
and we actually have incorporated it into our platform. So we've had great successes with it. We'd love to tell you some anecdotes if we have time, but we've had some great successes with Zinnia TV.
Yeah, I appreciate all the dialogue in the chat. This is great. I wanted to talk about our preliminary research. This was conducted across a variety of different care settings. So we did this research with skilled nursing facilities, assisted living facilities, and home care companies. And it was a really simple research design in that we deployed tablets, and most of these tablet deployments were part of grant initiatives. One happened through the Consumer Technology Association. Another one happened through Verizon's charitable foundation. And then we actually had a home care company that funded a pilot across 10 markets. And in these initial deployments, we wanted to capture some really basic data. We asked caregivers, when you engage the client with content, record their mood before the session. What did they come into the mood, or what did they, before you started the session, what was the mood of the client? What activity did you do? Was it music related? Were you watching a YouTube video? Were you FaceTiming with loved ones? So record the activity and then record the mood after the session. So in total, over the course of 18 months, we collected data on over 1,000 sessions, and we got really compelling preliminary evidence to show that the tablets were effective at helping caregivers manage mood. So I just inserted a few slides that specifically looked at sessions that started with somebody in a negative mood state. So we had 8 mood states for people to choose from: joyful, happy, and relaxed, which we considered positive mood states. And then indifferent or apathetic, confused, sad, anxious, angry, we considered negative mood states. So out of the 1,000 sessions, when we looked at the starting mood state, the most common starting mood state was a state of indifference. 408 of the 1,000 sessions had people starting indifferent. And when you look at the resulting mood states, over 85% ended with the care recipient being joyful, happy, or relaxed. And we got very similar results when we looked at mood states for confusion. Like again, 75 people started in a confused mood state, and over 80% of them were able to move into a state of joyful, happy, or relaxed. Same for people that started sad. Almost 90% of them, of the 65 people that started in a sad mood state, we were able to move them into a joyful, happy, or relaxed state. Similar results for people that were anxious, and also for people that were angry. So this is great used in kind of a PRN context to shift the mood. And I see some stuff in chat. And I think one thing to just note about this research, this was preliminary research. We didn't have a control group. This wasn't formal FDA monitored research, although we're working on that now. This was kind of our preliminary evidence base that we used to get funding from NIH for a feasibility study, which we just wrapped up.
With glowing results.
Yeah, the feasibility study went really well. The peripheral stuff, I touched on this. There's some interesting things happening. I'll link to some of the ongoing research that's happening in this space. To me, the most intriguing activity in the peripheral space is some work that Apple is doing with a pharmaceutical company also actually called Biogen. They're trying to determine what physiological biomarkers, things like heart rate or your gait, or even your voice inflection. So they're evaluating lots of different physiological biomarkers. Which of those are signs of MCI or progression of Alzheimer's and dementia? And the reason I think that research is so interesting is if we understand the physiological biomarkers that indicate a progression of the disease, it allows us to measure the efficacy of interventions in a way that is way more robust than we can now, because now we're relying on self-reports for caregivers and we're only capturing moments in time. Whereas if you have continuous monitoring of physiological biomarkers, now you have this entirely new set of data that can be used to measure the impact or the effectiveness of non-drug approaches. So that's really exciting. I think it's a few years out, but our team is really kind of invested in monitoring the findings of what type of biological readings may indicate a progression of symptoms or a progression of cognitive decline. I do want to take some time to talk through the challenges, because these are very real, and we've stared these challenges in the face for the past few years, but I am kind of encouraged that there's some progress happening and some of these barriers to entry are being reduced. So 3 main categories. I'm happy to share some additional information on any of these categories with the attendees. We're going to move through these pretty quickly, but the 3 primary categories are financial related things. So you gotta have a technology infrastructure, and that starts with connectivity. You need hardware, whether it's a music player or a tablet or a wearable, you need hardware. And then you need software, you need licensing to high quality software. I think that's the least of the concerns when it comes to barriers. There's usually, if there are compelling outcomes, there are means to finance some of these projects, whether that's through grants or whether that's through kind of return on investment. Operationally, that can be a little bit more challenging. when I met Robin and we did a project with music and memory in nursing homes, I had very little experience in the industry and I was more or less the tech guy. And I was shocked by the limitations of being able to involve families in personalized care because of HIPAA and compliance issues. And our team has made a huge investment in building the software infrastructure to allow for families to get involved and to allow for healthcare providers to save personally meaningful videos, photos, links, while maintaining HIPAA compliance. But that's a major challenge. And it's also challenging to integrate these types of solutions into existing software infrastructure, existing operational workflow. You know, as I'll discuss, there's a lot of siloed data when it comes to implementing engagement platforms where you have all your clinical data in one place and all of your engagement data in one place and all of your HR data in the other place. And it becomes really fragmented in a way that limits the potential of these solutions. But I think the biggest challenge is on the cultural side. And specifically when you're looking at facility-based care, and this is not true for all families, but for some families, when they make the very difficult decision of moving a loved one into a facility, they tend to disconnect and social isolation becomes a real challenge. So that cultural component is a barrier to implementing digital therapeutics. And then also just the staffing bandwidth. I mean, we're in the middle of a caregiver shortage crisis, right? Caregivers there are certain things that need to be done. I mean, people need to be fed, be bathed, activities of daily living need to be addressed, and staff only has so many hours in a day. So how do you implement solutions like this without overwhelming your staff? I think those are the three main categories of barriers. I won't spend a whole lot of time on this slide. Again, I'm going to share the slides if anybody wants to see them. Just did some rough estimates on the infrastructure that it would require to deploy digital therapeutics in a care community. This is going to vary substantially based on market, based on the type of solution that you're implementing. But there are most organizations have been making investments in this infrastructure over the past 10 years. And there are some interesting opportunities to leverage programs to supplement some of the expenses on the infrastructure side. Operationally, I had mentioned one of the big challenge is siloed data. So you have staff that's communicating with families. You have platforms and tools that are used to engage residents. And then you have platforms and tools that are used to manage clinical care. And so often these systems don't talk to each other. So there's a lot of duplication of efforts, and there's a lot of inefficiency in workflows because this data is siloed. And then specifically with digital therapeutics, the research is another component that makes demonstrating outcomes much more challenging. Staff just doesn't have the bandwidth to collect data, whether that's related to behavioral symptoms, perceived burden. There are a lot of different outcomes that you could look at, whether you're looking at financial outcomes, clinical outcomes for residents, or clinical outcomes for staff. It just becomes time consuming and burdensome to collect those types of data. But the biggest challenge, I think, is on the cultural side. Families can help with personalization, but oftentimes staff has limited actionable information about the residents' background, their cultural, meaningful rituals. And family can really help reduce the staff burden. But as I mentioned, families become increasingly disconnected. And then when caregivers are supported by family members, it improves their well-being and job satisfaction. We've been able to demonstrate that with some research findings, but oftentimes family members lack understanding about the disease progression and can actually complicate the situation or make it more stressful for caregivers instead of be part of the solution. Just also wanted to mention some additional cultural barriers. Staff can personalize sessions to optimize the therapeutic effect, but because staffing ratios are limited, most organizations favor group-based activities. One-to-one engagement helps staff earn trust, but as I mentioned earlier, there's a need to prioritize ADLs and certain task-based care. And staff can be more effective in recognizing and addressing behaviors as communication. But when there's high turnover and there's clinical challenges, it can be really difficult to balance safety, well-being, and mood management. So these cultural barriers are the ones that are probably most pressing and the ones that our team is most excited to dive in and try to address through our solution. So this is a fun part. I want to make sure we have plenty of time for some discussion at the end. I'm going to just talk through just a few of our thoughts on the future of digital therapeutics, and then show specifically how we're addressing this through the development of our mobile application.
Michael, Heather mentioned before she leaves that it may be beneficial to the nursing staff at memory facilities to be informed how much calmer their patients are when they use these digital resources, and it may make their job easier if patients are utilizing these devices.
Absolutely.
Yeah.
And what we're in the process of doing is collecting data to demonstrate that. If you have a research institution and a peer-reviewed article to prove that, it really helps provide some validity to that claim. But anecdotally, we've seen it time and time again, as I'm sure many of you have as well. So for digital therapeutics to be successful, there kind of has to be this convergence of digital lifestyle interventions, which a lot of these are already happening in communities. Most communities have solutions for family involvement or music or content, spirituality. But for these to be successful at scale, they also have to integrate with existing systems on the clinical side, so that the data is not siloed. Assessments, clinical care hands, behavioral health, they have to inform the digital lifestyle interventions, and then they have to be backed by research and outcomes. So the future of digital therapeutics is when these three aspects of technology in a healthcare setting converge. That's when we're really going to see the opportunity to make our healthcare system work smarter when it comes to dementia care and to improve outcomes, when the data supports the investment in these approaches. And we see reductions in things like hospitalizations. We see reduction in things like sedative medications being used on a PRN basis. When we can demonstrate those types of outcomes as a direct result from our engagement efforts, that's when the payers will really get behind and support these types of interventions.
And another side too, Michael, that I was thinking of was, just the caregiver satisfaction levels. Those things are huge. Developing trust with the person you're working with, to being able to have a more efficient bathing experience, being able to have a great feeding moment where the person's not throwing something across the table. I mean, that's of course, painting a negative picture, but the idea is to prevent that and to mitigate that in any way we can. So that's the goal here.
And this is like a very pie in the sky vision of the future. And who knows when we get there, but I truly think that one day we will get there, where these solutions are going to be most effective when they're informed by the entire healthcare team, physicians, behavioral health specialists, frontline care workers, and they're going to be available through a variety of channels, whether those are telehealth services, texting, peripheral devices, mobile apps, and they're going to inform the care and the assessment and the behavioral health management of people living with dementia. We're a ways away from this, but this is really kind of a vision for the future that could leverage technology to make a pretty significant impact on the people living with dementia. So I'd like to take these last 10, 15 minutes to just share kind of our team's approach to addressing some of the challenges and trying to leverage some of the tools to make an impact in the lives of people living with dementia. So our platform is really designed to engage healthcare teams on 3 levels. We have a mobile app that's designed for families to personalize input and to curate meaningful content and to stay connected to their loved ones regardless of their healthcare setting. So I'll show you what that app looks like. It's a mobile app. It's available on Android and iOS. And really what it does is it gets to know a little bit about the family member, and then it prompts them to share things like music, photos, stories, links to content based on the relationship with the client's level of dementia, and their proximity to the client. So for example, if somebody lives nearby, we might prompt them to go do a visit sometime and share an article with them about best practices about visiting your loved one with dementia. But if the family member lives hundreds of miles away, we might prompt them to do a video call and share a piece of content that gives them best practices for talking on the phone or connecting with video through a loved one with dementia. That personalized content syncs to a device that's managed by healthcare organizations. So we work with a variety of different healthcare organizations, home care companies that provide non-medical care in the home, companionship, or dementia care in the home. Also work with assisted living facilities and nursing facilities. And device from the family, or content from the family, syncs to a device, an iPad that's managed with HIPAA compliant settings so that healthcare teams can access that content. And then we prompt them to explore the care recipient's strengths, establish routines, and ultimately develop rituals that help ease symptoms. So I'll show you a little bit of how that works. And then finally, we have tools for case managers that are overseeing the care of the people living with dementia, that allow them to customize the non-pharma treatments based on the care setting, the scope of care, the client's preferences, and be able to measure trends in engagement and outcomes in terms of behavioral symptoms and caregiver satisfaction. So I think the best way to show that, for you to understand this, is to actually show it. So I want to share what the app looks like from the point of view of a family, from the point of view of a caregiver, and from the point of view of a case manager. So I'm going to stop my screen share a tab. So from the family's perspective, we're prompting them to upload 3 primary pieces of content. And this is my wife's grandmother who's living with dementia. And this is a profile that we use with her and my mother-in-law, who's our primary care partner.
And this is Michael's baby.
Yeah, that's my baby. And there we are on a recent visit. But what the 3 types of content that the current version of the app prompts families to do to share are photos. And we have some really specific constraints on photo uploads that are intentional. Families can't add photos without putting descriptive captions, and we prompt family members with specific captions to give them idea or specific suggestions to give them ideas for their captions, because we found the captions can be an incredibly helpful tool to give the photos context for the caregivers. So photos, meaningful photos with descriptive captions. We also prompt them to add topics. So again, depending on the relationship of the family member using the app, we're going to nudge them with emails and app notifications and try to get them to add content that might be helpful to the care team. So we've kind of organized some high-level categories, and then similar to with photos, we prompt the families with certain questions. Why is this topic meaningful? Can you share a story that might be related to this topic? And then our team will link content that's related to topics for the healthcare providers to leverage as part of the care routine. So this is an example of my wife's grandma, Bucky, always used to swing dance. So when we go and visit, we'll pull up some swing dancing videos to In the Mood by Glenn Miller. And, it really kind of sparks some enjoyable reminiscence for her.
And also, it actually detects voice. Our platform detects voice, so they don't have to type it in, they could speak it in, which is good.
And then similarly with topics, we prompt teams to add music. And then as part of our deployment strategy, we leverage ad-free music services. Things like, and we're currently working with some technology companies to deploy this at scale for enterprise. But through our preliminary studies and pilots, we've just been using things like Amazon Music, where a family member can create a playlist, staff can have access to that playlist, staff can modify that playlist, where you pull up a topic and there's a playlist on here. For staff to access that, they just tap on that link and it's going to open it up in the appropriate app. So this has been a really effective tool for us. Oh, and I'm not signed into my Amazon account. This has been a really effective tool for us, whether we were using YouTube or Amazon Music or Spotify. It's allowed us to make it really easy for the caregivers to access personalized music. So this is really the family experience. And like I mentioned, the secret sauce here is and this is something that we built out through, we got a grant in 2020 through the National Institute of Health to do a feasibility study. And there were some funds for research and development. And a lot of that funding went towards personalizing the nurture campaigns for individual family members based on their relationship, their proximity, their loved one's stage of dementia. And we saw, as Robin mentioned, we saw really promising adoption of the solution by families. Historically, mobile health apps have had a problem with adoption and utilization, and our utilization rates far exceeded the study aims. I think we had over 90% of families contributed what we considered a meaningful amount of content. They exceeded that threshold. So 22 of the 23 families were really active in the app and using it on a regular basis. So now that I've kind of shown this from the point of view of a family, I mentioned that that content becomes accessible to a caregiver. I also wanted to show how we interact with direct caregivers to measure trends and do assessments. And this is an example. So hopefully you can see my screen. I'm just going to move some things around.
Well, and one more thing I wanted to mention, Michael, too, about the study was that we've had over 60 families continue to use the platform, even though the study's over. So that's very exciting too.
So within the app, we are currently prompting caregivers to give us feedback on engagement. So this is how we're measuring engagement trends. So some of the engagement is happening on the platform, and we can get very specific analytics on how long are they looking at this photo versus that photo. But some of the engagement is happening off the platform. We might be prompting caregivers to go outside and spend some time in nature. We might be prompting caregivers to conduct a weekly video phone call with a daughter that lives hundreds of miles away. I mean, these are a combination of online and offline activities that we are prompting based on resident or care recipient data. And the way that we're measuring the trends is we're checking in with caregivers. And these surveys are designed to be really short and to the point, and they can be customized by case managers depending on which non-pharma treatment approach you think is most effective. Or you could turn on multiple non-pharma treatment approaches. So when a caregiver gets a check-in, we're just going to ask, how did Marion engage with music this week? And one of the things that we do in prompting caregivers is we encourage them to anchor these meaningful experiences to existing routines. So maybe they were just relaxing around the home. Approximately how many times did Marion spend relaxing with music this week? 4. And what we do is we're gamifying the engagement trends. So I mentioned this earlier, exploring strengths, establishing a routine, developing a ritual. We're encouraging caregivers to quantify their efforts in establishing some of these personally meaningful trends. And that data is then shared with case managers. So case managers, and I'm just going to switch to a manager view, can pull up client profiles, and they can see the results of these engagement trends. So the check-in that I showed was specific to music, but case managers can turn on check-ins and family prompts for music, for socialization, and for what we call pursuits of purpose, whether that's things happening offline, like physical activity walks, outings, games, other cognitively stimulating activities, or pursuits of purpose that happen online, reminiscing or apps. The case managers can turn on what types of prompts and trends they're tracking. And this is going to dictate what types of nudges we're sending to families and what types of questions we're asking to caregivers on a weekly basis. And then they can track the feedback from caregivers on a dashboard. So if we want to take a closer look at what's happening with music this week, we can see that Bethany was using music during bath time and Sarah was using music while preparing or enjoying a meal. So we can kind of drill into the details of how they're using these different engagement sources. So I think that gives you a pretty good flavor of how we're implementing this. The only other thing I'll mention is we also have tools to capture clinical data, things like client symptoms, and it works the same way that the Check-in does, where when caregivers sign into the app, they're prompted to complete an assessment for the client. And these are done on a less frequent cadence. We usually do these quarterly or monthly, depending on the research project or the goal of the healthcare organization. And that's really looking at things like behavioral symptoms. So in the past week, has Jane been asking the same question over and over? Let's say yes. How much has this bothered or upset you when it happened? So this is the revised memory and behavioral problem checklist, which is a clinical tool that we're using in one of our research projects that helps quantify some of these outcomes. And similar to the check-ins, all of that data is shared with managers through a dashboard where they're able to view the results of these assessments over time. So that was a lot of information. Hopefully it was helpful, thought-provoking, and I really appreciate everybody sticking with us and taking the time to kind of learn more about what we're doing and just the field of digital therapeutics in general.
And I also want to add too, in terms of all of that data that Michael just showed, when you're doing quality assurance studies, or if you're having a JACO review or whatever that is, or joint commission, this is very, very helpful metrics for you, and it's in real time. And that's really something that's very hard to get today. So it's pretty golden, I think. Questions? Thank you, Judy. Yes, routine is crucially important. Creating a routine is really essential. She said routine is so important for them as well. Absolutely. Anybody else?
Robin and Michael, you know, this whole presentation just triggered this whole memory of the movie 51st Dates, where every morning she started with the same video that oriented her for the day. And it's almost, that's what dementia and Alzheimer's patients really need, is that grounding, that orientation, that where am I, who am I kind of thing. And it would be really cool if that would be something that could be integrated into like a TV message that would come into their room that was specific for them to start their day off on the right foot. That was just a thought that I had, that all of what you're talking about triggered in me. I'm like, oh my God, you know, because they're so disoriented, which creates that anger and anxiety and all that agitation. And, you know, anything that can help them be calmer and more grounded can be really beneficial. I mean, I lost my mom 4.5 years ago to Alzheimer's, and it was 5 years of hell that she went through with us trying to keep her grounded. And she really knew who we were until like the last 3 months, which was really surprising. I mean, some of her grandchildren, her great-grandchildren were a little bit more confusing to her, but she knew my sister and I right up until like the last 3 months, which was a blessing, because for so many that doesn't happen.
Well,
absolutely.
It's also a testament to your efforts to keep your mom connected. I think that plays a huge role in it. And I think you made a great point about providing the grounding and context for them. And I think one of the challenges is the medium for conveying that essence of self evolves through the progression of the disease. So it
Yeah.
might be a conversation with you in the early stages. It might be a song kind of as the person progresses, and those things change, right? And they don't even change throughout the progression of the disease, but sometimes they'll change from day to day or hour to hour.
Right.
Mhm.
So it's about building this tool belt of different resources that you can leverage to provide that context or that grounding or that comfort, safety. But yeah,
I'd have to totally agree with Michael too, because, having been during the heat of COVID, being the director of memory care and assisted living, and it was really truly difficult. And the caregivers can have all the training in the world, and I'm a pro fan of training, but it doesn't necessarily translate into real time help. And so this is a way for them to have, I love the word toolkit, have a tool in their toolbox that they can pull out and say, oh, wow, look what I just did, and feel so good at the end of the day, knowing that they've made a difference in that person's life. And this is really a gift, really.
Susan,
Truly.
did you have something?
Yeah, Michael, is this available right now?
Yeah,
So
so
how do people get access to it?
we are right now, we are deploying this through partnerships with healthcare providers. So because we're still very much focused on research and outcomes, we're not going direct to consumers quite yet.
We will be.
Our goal is, our long-term goal and vision is in making this a commercially viable solution is to always make it freely accessible to family care partners and to build the value in the back end for healthcare providers. So if I'm a family care partner and I'm caring for mom and I'm not currently using a home care service, or mom's not living in a community, I'm just doing it on my own, we want this tool to be freely accessible to those people. And then the way that we're looking to monetize this, at least in the short term, is if mom needs the help of a home care company or a care facility, that they'll be able to access her content and some additional tools, but we'll be charging the healthcare organizations to leverage the tools on their end. So that's our goal, and right now we're kind of exclusively working in research context and pilot studies with some home care companies.
Michael, could
For
you
anybody that's
share?
interested, definitely reach out to us and let us know, because there's the projects that we're doing are coming together pretty quickly, and we're always looking for interested participants, whether it's in a variety of care settings, whether it's in the community without home care, in the community with home care, or for people that are living in the facility.
And Michael, I wanted to share the story that you had about the St. Patty's Day story, which I thought is so important, about how this tool really can make a huge effect on the healthcare ecostructure and the healthcare architecture of a person living with dementia.
Yeah, I think what Robin is referring to, and we've seen this time and time again across a variety of different situations, but when there's a cultural barrier between the care recipient and the formal caregiver, and there's the caregiver isn't familiar with the care recipient's culture or heritage. And one thing that we've found really successful is loading content that helps them to re-engage with that. And at the same time, the caregiver is learning about the person's cultural background or heritage. So we saw that with a gentleman that was Irish, and his caregiver was a immigrant from Africa, and she didn't know what St. Patrick's Day was. And he was surprised by that, and they watched some videos about that content, and it helped to kind of bridge that gap. So we're seeing that in some of these contexts. So I really appreciate everybody taking the time. I see some people jump in. If there aren't any other questions, we'll just be sure to follow up with the slides and any additional resources. If you have questions or thoughts, just let us know.